In this video, we're going to go over golfer's elbow, and that's where you have pain on the inside here of the elbow, off of that bony aspect here into that flexor mass. So those muscles that attach here run down the wrist and hand, pull the wrist up like this, can assist in deviating the hand several directions there. A lot of times it just becomes irritated, and patients will just go home and try to use ice, heat, stretching alone and expect it to get better. In a lot of cases, it doesn't. So in this video, I'm going to go over some really simple techniques to try to reduce your pain, improve your strength, and restore your functional use of your hand. The first thing we're going to do is just work on a simple stretch. We're going to go into a wrist extension stretch, straighten out the elbow, pull the wrists and fingers back. You're going to feel that all the way down. If that's too painful, back off a little bit. But you're going to work on going into full wrist extension with combined full elbow extension. You're going to hold that for around 20 to 30 seconds. Repeat that several times a day. Next is going to be some soft tissue work. You're going to take one of these myofascial balls. You can also use a tennis ball. You're going to go in that area here on the inside of the forearm and just kind of roll around here. We roll around holding pressure back and forth. You can take it with your other hand, just hold pressure, just kind of kneading around in the tissue here. That usually feels pretty good. We're providing that kinesthetic awareness, that proprioceptive input to the tissue that's been inflamed and irritated. That does really well at just the overall recovery process. Spend about 30 seconds, maybe up to 2 minutes on doing that several times a day. Next, we've got to work on adding a load or putting that tissue under tension. You're going to take a dumbbell, prop your forearm up, and what you're going to do is work on wrist flexion. So we're going to come up like this, bring the wrist up, really contract these muscles on the inside here, and then slowly lower that down. Bring that up again, hold that, really contract, maybe hold that for 2 or 3 seconds, slowly lower that down. Repeat that for 3 sets of around 10 to 12 repetitions. Next, we're going to work on forearm rotation. This is known as supination and pronation. So supination, palm up, pronation, palm down. Work that back and forth for 3 sets of 10 to 12 repetitions. As it becomes easier, you can grab the dumbbell at the bottom and then work that all the way into supination and pronation. Again, for 3 sets of 10 to 12 repetitions. Our last exercise is going to be using one of these grip trainers. What you're going to do is adjust this so that the repetitions get difficult at about 8 or 9. So we're stopping at about 10, 12, even up to 15 repetitions. You're just going to squeeze this. You're going to feel this all the way into the forearm. I usually have my patients squeeze that and hold that for maybe 2 to 3 seconds and relax. Squeeze and hold 2 to 3 seconds and relax. Repeat that for 3 sets of, again, somewhere between 10 to 15 repetitions. Thanks so much for watching. I hope this video helps with your golfer's elbow pain. Be sure to hit that subscribe button so you can stay up to date on all my content.